Now let's begin with the next topic, and that is the hypersensitivity reactions. Now, well, all of you know that there are a total of 4, but now 5 hypersensitivity reactions. So 4 were always known. We are going to add on one more. So now if someone asks you how many total type of hypersensitivity reactions would we be dealing with, and that is going to be a total of, I can proudly say 5. Okay, now 5 is certain. It is in the books. It is a 5 total hypersensitivity reactions, and this is known as the gel and comb classification. This is referred to as the gel and comb classification. Now please note guys that 5th one I will tell you along the way. Okay, I'll tell you what is the new one. For the time being, let us focus on these 4. Let us focus on 1, 2, 3, 4 because this comes as a question. So pehle let me tell you their common points, their names and everything. So I have learned the 4 hypersensitivities as acid. Why? Because type 1 hypersensitivity reaction. Type 1 hypersensitivity is going to do with all the allergies and anaphylaxis. Type 2 hypersensitivity reaction is going to be cytotoxic. I'll be killing something. Type 3 hypersensitivity reaction will have a lot of immune complexes. And type 4 hypersensitivity reaction is the delayed type. So let's do a repeat. I say type 1 is acid. Acid na? So acid matlab anaphylaxis, cytotoxic, immune complex and delayed type. These are the 4 things that I have to know for the 4 hypersensitivities. Further, what I can say is I'm going to make a commonality between the first 3. Why the first 3 guys? Anything? Why the first 3? What is common between them? Now between them I realize that I have a commonality that all of them utilize antibodies. In all of them there is going to be the involvement of antibodies, whereas, or in other words, I can say all of them are going to be antibody mediated, and type 4, which is the delayed type, that is going to be cell mediated. That's the only one where I'll be talking about cells. I'll talk about CD4 cells, CD8 cells. There I'll talk about cells, but in all the other first 3, I will only and only talk about antibodies. Please note, all these 3 I will talk only about some of the other antibody. Clear ho gaya? Should we start one by one? Should I start with the first one guys? Yes, with me everyone. Type 1 hypersensitivity reaction. But now, so when I talk about type 1 hypersensitivity reaction, please note I include all the allergies under it. When I include all the allergies under it, this means the first exposure that I'm talking about. The first exposure that I'm talking about is to some of the other allergen. So I will denote allergen with a yellow color over here. This is a yellow color allergen that we have. Now tell me, let me ask you, how much have you been listening up till now, or have you slept off through immunity? Whenever any antigen or allergen comes into my body, which is the first cell which is gonna pick it up? The first cell that picks up anything is an antigen presenting cell. And whom is it going to give that yellow color allergen to? Will it just throw the ball like that? No, it will keep it on a tray. What is the name of that tray? It was an MHC. It's gonna put the antigen onto an MHC and present it to whom? It is going to present it to the T cell. It is going to present it to the T cell. Now here the story changes. Tell me, T cell has what receptors? That also you know. T cell has what receptor? It has an alpha beta receptor. We've already done this also. Which T cell am I talking about now? This T cell will differentiate into Th2 cells. So in this entire story, the only thing that you had to learn was Th2 cell. Because tell me, what all is released by the Th2 cells? From the Th2 cells, we have the release of interleukin 4 and interleukin 5 and interleukin 13. Do we already know that information? Yes. Interleukin 4, 5 and 13. And that basically tells us that what are the functions of interleukin 4, 5 and 13? Maybe you can help me. Interleukin 4 is going to help in isotype switching. Haven't we already done this? Isotype switching basically means which antibody production is going to occur. There is going to be production of IgE that will happen over here. There is a production of immunoglobulin E, because I know that with allergy, IgE is involved. Other than that, there is interleukin 5 that is formed. Interleukin 5, A, B, C, D, E, 5th alphabet. What is it? It is going to activate the eosinophils. There is eosinophil activation that happens. And finally, interleukin 13, because interleukin 13 is going to result in mucus production, right? All in all, 4, 5 and 13, all of them come into play. And which antibody is created? IgE. So what is IgE going to do? IgE will say that now I'm going to go and sit on top of a cell. What is the name of that cell? The name of that cell is a very famous mast cell. The name of that cell is a mast cell, and look over here, there's a very important way of dealing with it. See guys, where is IgE going and sitting, or how is IgE going and sitting? Is it just going and sitting back to back, like stuck to each other? No, it's very nicely gone and distributed around the mast cell. It's distributed around the mast cell as if, you know, social distancing ke saath. One IgE, then a gap, then an IgE, then a gap. And you know what is this known as? This is known as a sensitized mast cell. I have sensitized a mast cell. So many of you believe that whenever an allergy happens, allergy has happened because of the first exposure itself. No. On the first exposure, the story stops over here. The mast cell is sensitized, but nothing has happened. The problem will happen later on. So what is, now imagine at the end of the first exposure, what did you get? A mast cell. And that mast cell is sensitized with a lot of IgEs. Now, what is roaming around in the body? I will say this sensitized mast cell is roaming around in the body. So now imagine when this comes the second time, I'm going to paste the same thing over here. Have a look at this. Now, when your second exposure happens, second time the same allergen comes, will the allergen go through that entire process again? No, the allergen will not go through that entire process again. Now, the second time the allergen will already find the sensitized mast cell and will just go and bridge the gap. It will go and sit between the gaps. That is what it's going to do. So now it is no longer a sensitized mast cell. Now this mast cell has undergone a polymerization. Now this mast cell has undergone a polymerization. So basically social distancing gaya. Pehle we were having IgE with social distancing. Now the second antigen comes, second exposure happens, social distancing gone. Polymerization results in what? It results in degranulation of the mast cell. The mast cell is going to burst, and as soon as the mast cell will burst, as soon as all the granules will be released, mast cell is the richest source of what? Mast cell is the richest source of histamine. So there is going to be a release of histamine that happens, and all of us know that in type 1 hypersensitivity allergies, it is histamine that causes everything. I'll repeat this entire process, but can you please tell me a question of the previous year? What is the special stain that you have for mast cell as well as for basophils? Mast cells and basophil ka special stain has been asked in the exam, and that is going to be toluidine blue. The special stain is going to be toluidine blue. Okay? So coming all the way back, quick revision. So whenever a first exposure occurs, it is always picked up by first cell, antigen presenting cell, which puts it on a tray called MHC, presents it to the T cell. The only thing that you had to learn was which T cell is it forming here? Th2 cell. Th2 cell is going to lay down what all? Interleukin 4, 5 and 13. 4 is going to make antibodies like IgE. 5 is going to get all the eosinophils for me, and 13 is going to make all the mucus. IgE will go and settle on the mast cell, so I call it a sensitized mast cell, and the story of the first exposure stops over here. Now when the second exposure happens, the sensitized mast cell is already there. The antigen will just go and fill in the blanks, and it will sit in those gaps and result in polymerization. Mast cell is going to burst like a water balloon, and all the histamine will be released. So now you can say that, okay, the process of mediators has started. So how many stages of type 1 hypersensitivity do we have? So please remember, the early phase that I am talking about, the early phase occurs within 2 hours, and this is because of the release of preformed mediators. Like for example, histamine. Histamine is preformed. Now you remember that from your inflammation chapter. There is release of histamine that occurs from where? That occurs from the mast cells. You know that there is something else that is also released from the mast cell, and that is known as tryptase. In fact, tryptase also comes from the mast cells. In fact, please remember that there is an increase in serum tryptase that you see in patients of allergy. You can see that in the blood levels also, because tryptase also comes from the mast cells. Then newly formed mediators will also start coming. What are the newly formed mediators? Like you have prostaglandins, you have leukotrienes, you have platelet activating factor. These are all the newly formed mediators, and what do they result in? Everyone knows what is the effect of prostaglandins and leukotrienes on the lungs, all of them cause bronchoconstriction. For that matter, what does histamine cause? Histamine also, सबसे पहले तो what is its effect on the blood vessels? It causes vasodilation. It causes vasodilation, and what is its effect on the lungs? It causes bronchoconstriction. Now, can you easily understand what is the mechanism for asthma? For asthma, all these mediators are released, like histamine is released, bronchoconstriction. That is what happens in asthma. Prostaglandins, leukotrienes, and PAF are released, bronchoconstriction. That is what happens in asthma. So now if someone asks you the entire pathophysiology of asthma, which I will only ask you when I go to the lung chapter, I will not teach you again. I will just say copy paste type 1 hypersensitivity over here and you are sorted. That is what you had to know for the early phase. In the early phase, a lot of these preformed mediators and new mediators are released. But what about beyond 2 hours? Allergy doesn't end in 2 hours, right? Beyond 2 hours, we have the delayed phase, and the delayed phase is because of eosinophils. Can you recall who got eosinophils for me? Which interleukin got eosinophils for me? It was interleukin 5, A, B, C, D, E. I always say E for fifth alphabet. Interleukin 5 got eosinophils for me. And as a result of which, these eosinophils release MBP, that is major basic protein. It got MBP or major basic protein, and this major basic protein will help in doing all the damage thereafter. ये बहुत important question है, very important. Previous year, one liner, who releases major basic protein? Major basic protein comes from eosinophils. ठीक है, everyone's okay. So now you have understood the type 1 hypersensitivity. If I had to ask you one last take home message, which hypersensitivity or which T cell do you use over here? TH1 or TH2? You use TH2. तो 1 में 1 नहीं use करना. 1 May you are not going to use TH1, you are going to use TH2. That is your take-home message. Now, what did you call all of this? You called all of this anaphylaxis, because which Ig was involved? Which immunoglobulin was involved? IgE. So the patient had, bronchoconstriction, shortness of breath, anaphylaxis, life-threatening. There is also something known as anaphylactoid reaction that can occur, but the difference between the both of them is that in anaphylactoid, it is anaphylaxis like. Anaphylaxis nahi hai. It is not anaphylaxis. It is anaphylaxis like, which means that over there, IgG will not be involved. So they ask you this question, and they have asked you, if you go back to your previous years, they have asked you that what is the difference between anaphylaxis and anaphylactoid. So remember, IgE ka involvement nahi hota, but everything else in terms of symptomatology is going to be the same. So now you've studied everything. Mechanism ho gaya. Are you ready for the examples? The examples, one class number 1, first standard, what did they teach you? They taught you ABCD. What will I teach you? Another ABCD. So let's start with ABCD. The first thing that you have to know with, so remember type 1 hypersensitivity ka mnemonic, first class mein ABCD. So A is going to be for all kind of allergies that you have. For all kind of allergies that you have. So now that could be any allergy of their choice. That could be allergic dermatitis. They could talk about allergic rhinitis. They could talk about allergic conjunctivitis. But let me ask you an off-thal question over here, guys. What is allergic conjunctivitis also known as? Dusra naam batao. What is the other name for allergic conjunctivitis? It is VKC. Allergic conjunctivitis is also known as vernal keratoconjunctivitis. VKC, vernal keratoconjunctivitis. Why am I asking you this? Because next time when you go to off-thal, the drug of choice will give you a recall of path and micro. Why do I say that? Because VKC is nothing but an allergic conjunctivitis, and the drug of choice that you have for VKC is going to be olapatadine. So have you ever wondered that why in VKC do I give olapatadine? What is it about olapatadine that I want to? What is the mechanism of action of olapatadine? I'll tell you the mechanism of action and everything will, make sense. Olapatadine is a mast cell stabilizer. When I say mast cell stabilizer, it's making sense that it won't let the mast cells burst. That water balloon bursting that was happening now, that it will not allow. If it does not allow, that basically means histamine will not come out. What if a little bit of histamine also comes out? They said that this olapatadine is also an antihistaminic in nature. It is also having antihistaminic property. One drug, double action, very, very important. So if you get a question in Pharmac, olapatadine is what? Is it a mast cell stabilizer or an antihistaminic or both? It is both. But primary action kya hai? Primary action is it will not let the mast cell burst only, it will stabilize it. That is why in allergic conjunctivitis or vernal keratoconjunctivitis, your drug of choice is olapatadine. So all the allergies and any other allergy written in the paper. So these are just few examples. Then allergic something written, mark type 1. Have you also heard that sometimes allergies run in the family? Allergies run in the family. Like you will say that father also has peanut allergy, daughter also has, or mother also has egg allergy, daughter or son also has. Suna hai na? That is basically meaning that they say that there is allergy with a genetic determinant. Allergy with a genetic determinant, that is known as atopy. So you will say genetics matlab, ma'am, you are now going to tell us some chromosome in that long list. You're going to add one more. I will add and I will also make it easy. Matlab atopy is how many alphabets? 5 alphabets na. So what is the chromosome associated with atopy? 5 chromosome. Easy hai na? This I have not made it very tough. Atopy 1 2 3 4 5. So 5 alphabets, 5 chromosome. So A ho gaya. What is with B now? We were doing one mnemonic A B C D. And B is the same thing because allergy also includes bronchial asthma. Allergy also includes bronchial asthma. तो कुछ नहीं, बस B याद करा खत्म. C is going to be from parasitology. What test? There is a test called as Cassoni's test, and let me remind you, Cassoni test is a test for what? Although no one does it, it is obsolete. In practice, no one does it now. But Cassoni test is what? Cassoni test is a test which is done for Echinococcus granulosus. Echinococcus granulosus, which is nothing but hydatid cyst. Hydatid cyst ka test tha, but no one does it now. Then after that you have D. D for what? D for drugs. Drugs like, for example, whenever you want to give a test dose or whenever you want to give penicillin, always give a test dose of penicillin. If I say I gave a test dose of penicillin, right now I want to give the patient penicillin, but first I'm giving few ml of penicillin and testing that is he allergic or not. I'm basically trying to find out drug allergy with a test dose. That is, and agar usse allergy hua, if he has allergy with that test dose, I will label it as type 1. But if they come back to you saying that you gave penicillin and 5 days later or 10 days later patient is having a problem, that you will not call as allergy, that you will put under type 3 and type other hypersensitivity reactions, hai na? So please remember that type 2, type 3 wo dusra mein jayega. This I'm only talking about an allergy which is happening on giving a test dose. So please read the question carefully. So coming back, when I say ABCD, we have allergies, atopy, bronchial asthma, Cassoni test and drugs. Also apart from that, there are some few miscellaneous ones which no one does nowadays, but pad lo. There is something known as a PK reaction. And then there is something known as a Theobald-Smith phenomenon. These are also types of type 1 hypersensitivity reactions. If you can learn after ABCD, remember PK and Theobald-Smith reaction or phenomenon. So in type 1 hypersensitivity, I taught you first class wala ABCD. Very, very simple. Now what am I going to go on to? Type 2 hypersensitivity. Obviously, first I will tell you the mechanisms. In type 2 hypersensitivity, the mechanisms are going to be 3 types. You just have to ratta lagao the name. I'll tell you why. Because if you ratta lagao the name, the mechanism is in front of you. See, type 2 hypersensitivity is also antibody mediated. It is also antibody mediated. So you will say, matlab, ma'am, wherever there is an antibody, there has to be an antigen. So matlab, there is an antigen-antibody reaction that is occurring. Whenever there is an antigen-antibody reaction, so for example, if this is an antigen, which is the antibody which is going to come and opsonize it? Which is the antibody which is the best opsonant? IgG. So IgG is going to come and opsonize it like this. So yes, and if opsonization hua, to what is going to happen? There is going to be phagocytosis. So what is the first mechanism of type 2 hypersensitivity? It is opsonization and phagocytosis. Have we already studied it? Yes. Coming to the next, I also told you that when there is an antigen like this and you have covered it with something called IgG, is that also going to be identified by some cells called the NK cells and the macrophages and others, resulting in ADCC, antibody dependent cellular cytotoxicity. Antibody dependent cellular cytotoxicity. Have we already studied it in NK cells? Yes, so that is the second mechanism of type 2 hypersensitivity. What is the third mechanism? Now, everyone on this planet knows that whenever there is an antigen and an antibody reaction that occurs, it is going to go and activate the complement system. It is going to go and activate the complement, and complement system activated means there is going to be hypersensitivity, immune system is activated, inflammation hoga. So that becomes your third mechanism. So as I said, if you've ratta lagaut the name, then you're sorted. In the first, the name is opsonization and phagocytosis. So this is going to be related to opsonization. Second is antibody dependent cellular cytotoxicity, the NK cell wala concept. The third is going to be complement activation, exactly what we have done over here, complement activation. So type 2 hypersensitivity mein complement activation hota hai. Then we have the presence of ADCC, and then we have the presence of opsonization. So remember, type 2 hypersensitivity mein cow, or some people can learn it as, instead of opsonization, also as phagocytosis. So basically, CAP is what you can learn type 2 hypersensitivity as. What are the three mechanisms? Complement, ADCC and phagocytosis. Now I can explain the examples to you. बहुत simple है. Examples में the mnemonic is, my blood group is RH positive. My blood group is RH positive. Let's get going. What do I have with my? My ke liye we have my wala disease, that is myasthenia gravis. In my we have myasthenia gravis. In blood, for blood we have blood only. This means blood transfusion reactions. All blood transfusion reactions are going to come under it. So my blood group. So this is going to have a lot of things. So G is for something known as good pasture syndrome. Where do you study good pasture syndrome? I will be teaching this to you in kidney and lungs, in both. Good pasture syndrome. G for good pasture syndrome. But not only do I take the G over here, I also take GR together, because that is going to tell me a kind of a thyroid disease with GR, and that is Graves' disease. So remember, the G alone is going to be good pasture syndrome and GR is going to be Graves' disease. Now we move on to my blood group is. So what is the I going to be? I is for two things: immune hemolytic anemia and immune thrombocytopenic purpura. Immune hemolytic anemia means antibodies will break hemolytic anemia, RBCs. So the RBC is going to break down. ITP means immune thrombocytopenia. The platelet is going to break down. So basically in both the cases it is because of antibody, because type 2 hypersensitivity is all about antibody. My blood group is RH. So simple concept. If blood transfusion reactions, A positive ko B positive chad gaya, B positive got A positive by mistake. If blood transfusion reactions go that way, then RH incompatibility is also going the same way. If RH negative person got an RH positive blood by chance, so that RH incompatibility is also going to happen over here, right? RH incompatibility. So my blood group is RH. Not only is RH going to be RH wala RH incompatibility, I will add a D in front of it, because rheumatic heart disease is also going to come over here. So my blood group is RH positive mein. When I'm talking about positive, remember P is going to be for two things. One is going to be the very famous skin disorder, that is pemphigus, the bullous disorder of the skin. And P is also going to be for an anemia that I have discussed in RBCs, that is pernicious anemia. Pernicious anemia is what? It's a kind of a megaloblastic anemia, B12 deficiency. That is also type 2 hypersensitivity. So repeating all of this for everyone, repeating once again, my for myasthenia gravis, blood for blood transfusion reaction, G for good pasture, GR for Graves' disease. Then we have I for IHA and ITP. My blood group is RH for RHD and RH incompatibility. And P for PP, PEPE matlab pemphigus and pernicious anemia. That is, my blood group is RH positive, but now is a twist in the story. That twist in the story is, I am going to take the two Graves out of it. What are the two Graves? Ek to hai myasthenia gravis, because gravis word aa raha hai, and the other is Graves, because again grave, all the grave things I'm taking out. Because now please remember that all these grave things are being put under type 5 hypersensitivity. What did I say? These two grave things. grave things are now classified as, type 5 hypersensitivity. What was the reason? Why did I classify them as type 5 hypersensitivity? Because let me explain both of them to you. Myasthenia gravis, what is the antibody against? Yes, myasthenia gravis, antibodies are against acetylcholine receptor, not just a molecule, it's against a receptor. Okay, so in myasthenia gravis, I can see there are antibodies against acetylcholine receptor. Similarly, if I ask you what is happening in Graves' disease, you will say in Graves' disease, there are antibodies against TSH receptor. Again, these are very important things that I have just taught you. There are antibodies against number 1 acetylcholine receptor and antibodies against TSH receptor. So my concept says that whenever there are antibodies against some cellular receptor, you will label that as a type 5 hypersensitivity. Cellular receptor, like in myasthenia gravis, it is acetylcholine receptor. For Graves' disease, it is thyroid, so TSH receptor. That is important. One more thing that I want to tell you here. Whenever I'm saying antibody, see, whenever the antibody is going, any disease out of these, antibody kaam kharab kar raha hai. Antibody is destroying things or is suppressing things. Means here acetylcholine will not work. Here what will happen? The skin problem is going to happen. Here B12 deficiency will happen. Here RBCs are gone. Here platelets are gone. Matlab it is always gone that I'm talking about. But there is a problem or there is an exception in Graves' disease. So when an antibody comes, you expect that the thyroid function should go down. But tell me, is Graves' disease thyroid function going down? Is Graves' disease a hypothyroidism? No. Graves' disease is a classical hyperthyroidism. So, can I say that these antibodies that I'm talking about, they are a little different. These antibodies that I'm talking about in Graves' disease, they are not suppressing the work. They are stimulators. They are doing the opposite work. Ye jaake thyroid ko aur stimulate karenge. They will tell the thyroid do more work. Can I call these antibodies as thyroid stimulating antibodies? Yes, sounds well. I am calling them as thyroid stimulating immunoglobulins. They are the only ones where there is going to be increase in work. In all the other things, the work was getting suppressed. Here, the work is going to be more. Thyroid stimulating antibodies. They were earlier known as LATs. LATs also means the same. LATs means long-acting thyroid stimulators. LATs means long-acting thyroid stimulators. So repeating once again, we have TSI, thyroid stimulating immunoglobulins. Stimulating word is coming. LATs, long acting thyroid stimulators. Wherever stimulating word is coming means the thyroid will be stimulated. Now you understand that everywhere the work was getting low, but in Graves' disease I'm landed up with hyperthyroidism. Coming all the way back, these were all examples of type 2 hypersensitivity. You have learnt it beautifully in the form of my blood group is Rh positive, and from the two you took out the grave and the grave and you classified them now as type 5. What do we move on to next? We move on to type 3 hypersensitivity reaction. What was the name of type 3? Can you recall? Socho. What was the name that I taught you? I gave you one mnemonic called acid. A was type 1 anaphylaxis. C was cytotoxic. I kya tha? I was immune complex disease. It is immune complex disease. Chalo, let's get going. So, matlab, ma'am, you have to make an immune complex. The story will be immune complex. And what is immune complex? You are intelligent students, you know. Immune complex is antigen and antibody. So, somehow, everywhere I am revolving around the same thing. So, you will say, what is happening? In the previous hypersensitivity also, ma'am, you were talking about antigen antibody. Here also, you are talking about antigen antibody. When there is no difference, then why are you calling them 2 and 3? So, difference to hoga na? And that is what I want to tell you. So listen to this mechanism, you will see your difference yourself. So type 3 hypersensitivity occurs in 3 phases. What did I say? Type 3 hypersensitivity occurs in 3 phases. So first is going to be the antigen and the antibody have to combine. The antigen and the antibody have to combine. So the first phase is immune complex formation. The first phase is immune complex formation. So you will say, how will the antigen and the antibody combine? So these are antigen and antibody, both of them love roaming around. Antigen is also roaming around in my blood, antibody is also roaming around in my blood, and roaming around, they are going to meet and they are going to form a complex. So basically, the antigen is also going to be in the mobile phase and antibody is also going to be in the mobile phase, and ghumte ghumte mil gaye, they are going to roam around and they are going to meet. So there is going to be antigen, antibody. Now they are roaming around together. Earlier they were doing solo travel. Now they are roaming around together. But till when will they roam around? After some time they got tired. They said, okay, let us go and deposit somewhere. There is going to be the second phase, that is immune complex deposition. So remember, the antigen and the antibody decide that now a lot of roaming around ho gaya. Let me just go and sit somewhere. They can go and sit in the joints. They can go and sit in the kidney. They can go and sit in the skin. They can go and sit in the serosa. Their wish. They can go and sit anywhere in the body. Their wish, na. So usually, please remember, usually it is the medium-sized immune complexes that create the most problem. Usually it's the medium-sized immune complexes that create the most problem. So repeating once again, first is immune complex formation, roaming around, antigen roaming around, antibody roaming around, roaming, they met and then they were roaming around together. Then they thought, till when will we roam around? Let us go and sit somewhere. They could sit in any of the organs, that was deposition. Of general pathology and also in my general microbiology, I have studied that the antigen and antibody will always ultimately result in complement activation. They will always result in complement activation, and complement activation means that the patient is going to land up with signs and symptoms. These are the three phases. Arrange them in the correct order. What is the first phase? The first phase is going to be the immune complex formation. The first phase is immune complex formation. After that, the next is deposition and the next is complement activation. Kitna time lagega? How much time is this entire process gonna take? This entire process takes, please note very carefully, it takes 10 to 14 days. The duration, they ask you a question, the duration from the starting till the end, how much time does it take? It takes 10 to 14 days. Or from the starting to the appearance of signs and symptoms, how much time? 10 to 14 days, mainly 2 weeks it is gonna take. I hope everyone's okay with this. Yes, this was your basic mechanism. I will be able to explain this better to you as soon as I tell you the examples. But before that, what did you notice as a difference between type 2 versus type 3? Because in type 2 also, there was an antigen and an antibody involved. In type 3 also, there was an antigen and an antibody involved. And I know for a fact that antibody to hamesha is ghumakkad. Antibody is always going to be mobile. It is always going to roam around. Antibody to always roams around in my blood. The difference is that in type 2 hypersensitivity, the antigen was fixed. The antigen was fixed means, like, let me ask you, Graves' disease. Where was the antigen fixed? TSH receptor. Thyroid mein fixed tha. Antigen was not roaming around. Antigen was fixed on the thyroid. If I ask you a case of pemphigus, pemphigus is a skin problem. The antigen is fixed on the skin. It is not roaming around. If I ask you myasthenia gravis, acetylcholine receptors, they are stuck at a place. They are not roaming around. Antigen was fixed. Only one person was roaming around, that was antibody. But in type 3, what has happened? I told you both of them love roaming around. Antigen is also roaming around in the blood. Antibody is also roaming around, and roaming mein they are going to meet, and that is what is type 3 hypersensitivity. On that note, I can tell you finally what are the examples of type 3 hypersensitivity, and the mnemonic for that is going to be SHARP. So what all do we have to know about SHARP? So first and foremost, we will write the mnemonic S. S has a lot of things. Have you heard of an autoimmune disorder called SLE? SLE comes under SHARP. Then we also have something known as serum sickness. We also have something known as serum sickness. What sickness? Sickness to understand is fever and sickness. What is serum? Someone got excessive injections of anti-tetanus serum, or someone got excessive injection of anti-rabies serum. Basically something in too much of quantity. Too much of serum was injected. That will result in serum sickness. And the last S is going to be the Schick test. Or Schick test is used for which bacteria? It is used for Corynebacterium diphtheriae. Coming to the next, we have something called H. What is with H? There's a very famous disease called Hinoch-Schönlein purpura. There is Hinoch-Schönlein purpura. that you have to know, and that is type 3. Why is it important? It's a vasculitis. Which vasculitis? It is an IgA mediated vasculitis. It's an IgA vasculitis that occurs in chota kids, that occurs in children. That is Hinox-Schönlein purpura. Okay. What is with the next one? And that is A. A stands for Arthus reaction. What is Arthus reaction meaning? Arthus reaction basically means that when we are talking about type 3 hypersensitivity, what was the other name? Immune complex disease. And immune complexes were depositing everywhere in the body. Immune complexes were depositing everywhere in the body, but Arthus reaction is a localized version. Arthus reaction is a localized version. It is a localized immune complex disease. It is a localized immune complex disease. So that is A for Arthus. Now we have next, that is R. What is R going to be? R stands for Raji's assay. Now, this is an assay which was done once upon a time when they wanted to test for type 3 hypersensitivity. However, now this assay is no longer done, right? So, but you have to just know for MCQ. So, our Raji's assay is going to fall under type 3 hypersensitivity. Another R that we need to know over here is going to be the reactive arthritis. Please note, I'm not writing rheumatoid arthritis. This is the reactive arthritis that comes under type 3 hypersensitivity. Finally, coming to the P stands for the sharp mnemonic P. P stands for two very important diseases called PSGN. What is PSGN? Post-streptococcal glomerulonephritis. What is the color of urine in post-streptococcal glomerulonephritis? It is the cola-colored urine. And finally, another P is a vasculitis known as polyarthritis nodosa. In fact, guys, please note, there is another P which there's again a lot of confusion that happens around that P. And that P is parasitic diseases. Now, suddenly everyone says, oh my God, parasitic diseases, parasites are IgE. IgE should have been type 1 hypersensitivity. Why are you putting it under type 3? And all those confusions happen. I'm not talking about parasitic diseases. I'm talking about complications. I'll give you an example. Malaria does not come under type 3 hypersensitivity. But if malaria is what? Fever with chills, maximum cerebral malaria. But malaria mein agar kidney gets involved. In malaria, if the patient ends up having nephrotic syndrome, that is a complication. Where will that come? That will come under type 3. So samajh aaya? It's not the parasitic main infection, but it's the complication of the parasite which can come over here. There you have the sharp mnemonic. Three things with S: SLE, serum sickness and Schick test. H stands for Hinox-Schönlein purpura. A stands for Arthus reaction. R stands for Raji's assay and reactive arthritis. P stands for PSGN pan and parasitic complications. That is type 3 hypersensitivity, which leaves me with the last one, that is type 4 hypersensitivity. Okay, when I say type 4, do you remember where have I come? From that acid mnemonic. What was type 4? This was a delayed type of hypersensitivity. This was a delayed type of hypersensitivity, point number 1. And point number 2, this was the only one which was cell mediated. Rest, whatever I have spoken, look at this. In type 1 hypersensitivity, I told you which antibody? IgE. So type 1 was antibody mediated. 2 and 3, I told you there's always antigen-antibody reaction. So everything has been talking about antibodies till now. First time I'm going to talk about cells. So remember, this includes the CD4 T cells also, and this includes the CD8 T cells also. All the cells are going to come under it. Now think logically, again something that you already know. Whenever an antigen comes into our body, which is the first cell which picks it up? Antigen presenting cell. Keep answering with me. Antigen presenting cell will pick up that antigen and put it where? On that tray. What is the name of that tray? The name of that tray is MHC. It is going to go and give it to which cell? It is going to go and give it to the T cell. This time which T cell is going to form? Now TH1 will form, because I know TH1 releases something very famous, interferon gamma, and G for gamma results in G for what? All this I have taught you earlier. G for gamma results in G for granuloma formation. So finally, can I say in type 4 hypersensitivities, I have a lot of granuloma. So the only question that comes is granuloma forms or is formed from which interferon? In granuloma is formed from gamma interferon, and who releases it? TH1 releases it. So can I simply put out a question over here, and that says that if I have to differentiate type 1 and 4, the first and last, where was TH1 being used? 1 में 1 नहीं था. In TH1 was not being used in type 1 hypersensitivity. In type 1 hypersensitivity, it was TH2, and in type 4 hypersensitivity is TH1. So keep these ones and ones away. One mein one nahi use hota. That is your final thing that you have to know. Coming back, in type 4, I am using TH1, which releases interferon gamma and causes granuloma formation. But that's not just T helper cells. Even CD8 T cells are going to work. How do they cause killing? You already know. What are the two mechanisms by which they cause killing? Number one is going to be apoptosis, jo pata hai, and the other one is the perforin granzyme pathway. The other one is the perforin granzyme pathway. So are you ready for the examples? Because the examples are super simple. First, no mnemonic needed here. First example is going to include all the granulomas, the TB wala granuloma, all the other granulomas that you have studied. And if you have put granuloma, you will also put all their skin tests. So can you tell me, TB has granuloma, na? So TB ka skin test is what? What is the skin test of TB? The TB skin test is the Montu's test. Okay. Leprosy can also have granulomas. Okay. So leprosy ka skin test is what? It is Lepramin test. So every skin test is also going to come over here. Coming to the third one. Very, very important. This is also seen in conditions called inflammatory bowel disease. This can also be seen in multiple sclerosis. This can also be seen in multiple sclerosis. And finally, this can be seen in contact dermatitis. This can be seen in contact dermatitis. This is very interesting because when I say contact dermatitis, students ask me contact to what? So that depends on which part of the globe you are living in. If you're living everywhere else other than India, so if you ask me contact to what is most common worldwide, I will say it's a poison that is plant poison ivy. It is in contact to poison ivy. But if you are in India, the problems are totally different. Either it is exposure to a lot of detergents, because you know, na, detergent, hand washing is of clothes and utensils is very common in India. Abroad, you have more usage of washing machines and dishwashers, but in India, there is more hand washing. So detergent usage in contact with hands. And secondly, a lot of artificial jewelry is also worn more in India, and that artificial jewelry, especially women, will come to you with contact dermatitis somewhere around the ears or somewhere around the neck, or you know, wherever jewelry is worn, because artificial jewelry contains nickel and cadmium. Artificial jewelry contains nickel and cadmium, and that is why women suffer from it. So overall, women tend to suffer from this more because detergent usage, washing of clothes, washing of utensils is done more by women, although the hostel boys are not going to agree to this. But yeah, washing of all these things is done more by women using detergents, and artificial jewelry is also worn more by women. So in India, contact dermatitis by, you know, in general is more common in females. So I don't need a mnemonic for it. All granulomas ke saath sare skin test. Inflammatory bowel disease, because is there any inflammatory bowel disease that has granulomas? Crohn's disease, Crohn's also has granuloma, so same ho gaya. Then multiple sclerosis can have type 4, and contact dermatitis can also have type 4. Am I done with all the 4 hypersensitivities, and do I need to revise type 5 with you? I don't think so. I suppose that type 5 hypersensitivity pata hai na. I told you there were 2 grave things that were going to come under it. There is something known as myasthenia gravis, and then there is something known as Graves' disease. Both of these are going to fall. Both the grave things will fall under type 5. This we've already studied. What is type 5? When there are antibodies against cellular receptors. That was type 5. So in myasthenia gravis, there were antibodies against acetylcholine receptors. In Graves' disease, there was antibodies against the TSH receptors. So again, like I told you, na, I'm in touch with students so often that I get to know कि क्या doubts hai which you're going to get after listening to this lecture. Everyone asks me that, ma'am, you have taught us myasthenia gravis and Graves in type 2 also and type 5 also. What will I mark in the exam? Exam mein you will mark the updated version. If 5 is there in the options, then just blindly mark 5. If 5 is not there in the options, then you will mark 2. So if the options are 1, 2, 3, 4, 5 hai hi nahi, then you will have to mark type 2. But if I say options are 2, 3, 4, 5, if 5 is written, you will always mark 5, irrespective of 2 being there or not in the options. 5 hai, so you will mark 5. But if 5 is not in the options, then you will mark 2. Everyone, I hope, has understood hypersensitivities, but hypersensitivities are not over, because I am now going to really get myself into a lot of controversy because we are talking about the controversial hypersensitivities. I don't think all of these are controversial because SLE though I told you comes under what? SLE comes under sharp mnemonic, type 3 hypersensitivity. But now they say that SLE is actually a combination of type 2 and type 3 hypersensitivity. It is a combination. Yeah, it is more of type 3, I agree. That is why you put it under sharp mnemonic. But it's actually a combo. Kaise yaad kare? Because it could be 2 and 3, 2 and 4, 1 and 2. Like this options will be given in the paper. So how I learn it as is easier way that if I flip the S, I will get a 2. And if I flip the E, I will get a 3. So what two hypersensitivities make up SLE? 2 and 3 make up SLE, but 3 is more common. So SLE ka controversy sorted. When we talk about rheumatoid arthritis and hypersensitivity pneumonitis, these are type 3 and type 4 hypersensitivities that are there. Type 4 ज़्यादा common है, but type 3 and 4 का combination. तो अब SLE won't be a confusion ना. SLE is 2 and 3. That is why I gave you the mnemonic. Rheumatoid arthritis and hypersensitivity pneumonitis are 3 and 4 का combination. Transplant rejection. For the time being, I will have to just mug it out for you. Just say it out, because if you've read the transplant section, you will understand this. But if you've not, abhi ke liye pad lo. When I go to transplant section or when you start reading those lectures, you will automatically understand. Hyperacute rejection is type 2 hypersensitivity. Chronic rejection is type 4 hypersensitivity. And acute is a combination of the two. It is little bit of type 2 and little bit of type 4. So what did I say? There are 3 types of transplant rejection: hyperacute, acute and chronic. Hyperacute is going to be type 2. Chronic is going to be type 4. So acute then lands up to be a combination of the two, that is type 2 and type 4. We finished all of our hypersensitivities. It's time for 2 questions. Here you have a 30-year-old HBsAg positive female. Very interesting question, because only someone who's read systemic path will understand this. 30-year-old HBsAg positive female complains of feeling generally ill and fatigued, having fever, having loss of appetite and weight loss. So generally ill, fever, fatigue, loss of appetite, weight loss. There's muscle involvement, there is joint pain. So a lot of systems are getting involved, but what is not getting involved is the cardiopulmonary discomfort. There is no cardiopulmonary discomfort noted. They decided to do an arteriography and they found irregular narrowing and dilation of the blood vessels is noted. So definitely this is a kind of a vasculitis. And if I remember my pathology part well, the vessel is showing fibrinoid necrosis. One thing very commonly showing fibrinoid necrosis is which vasculitis? Polyarthritis nodosa. And we always study P is not for P. Polyarthritis nodosa does not involve the pulmonary system, and that is what they have written. There is no cardiopulmonary involvement noted. Also, polyarthritis nodosa is very commonly seen in HBsAg positive people. My patient is also HBsAg positive. This is definitely a case of polyarthritis nodosa, which comes under the mnemonic sharp. If it comes under the mnemonic sharp, this means it is a kind of type 3 hypersensitivity reaction that we have to note it. I hope everyone's okay with this. There is no confusion. Yes. Can we do one more question, which will be, I think, advantageous for us? Here you go. There's a 42-year-old patient who's presented with cough, sputum, weight loss, fever, night sweats. Hamari country mein TB diagnosis has been made. On sputum examination, there are multinucleated giant cells with lymphocytes, with macrophages. Slipper-shaped nuclei are noted. Come on, this is the classical description of a granuloma, and in our country with this description, I'm certainly thinking of tuberculosis. There's no doubt about it. So what do I have to do next? I have to find out granuloma comes under which hypersensitivity. Granuloma comes under type 4 hypersensitivity. So the answer to this question becomes type 4. I hope it's okay. No confusion. Sorted. Because with that, you have wrapped up your hypersensitivity mnemonics. Your hypersensitivity is sorted. Now you are going to move on and do the next topic, and that is going to be the tolerance and autoimmune disorders.